Hello, everyone. I am Tomoyuki Kashima, at Oculofacial Clinic Tokyo. In this video, I'd like to share information about orbital decompression, one of the most effective and fundamental therapies for Graves' disease. First of all, let me thank the patients who kindly shared their photos. Let me show the protrusion of the eyeballs. The patient is a female at around 20. Her eyes used to be nothing unusual, but the thyroid eye disease caused her eyeballs to pop out. This made her eyelids puffy and caused bags under her eyes, causing her to keep her eyes wide open. The impressions are completely different. The wide-eyed face can look intimidating. Thyroid eye disease, the eye symptom of Graves' disease, makes such a difference. This can only be treated by surgery. This is not all about the impression. The protrusion causes collateral symptoms. The eye symptom causes the eyelids to pull up, exposing the eyeballs. The cornea also becomes cloudy and the white part of the eye is exposed. Thus, the patient suffering from this symptom feels that their eyeballs are drying up, they can't see well, they feel that the back of their eyes is sore, they see double, and they have a threatening look. Graves' disease thus causes many symptoms in the eyes. Many people are desperate and suffering from these symptoms. The protrusion of the eyeballs does not disappear spontaneously, but we can treat it with surgery. Even if the eyeballs are significantly protruding, it is possible to improve them through surgery, although the extent of improvement depends on the stage of the disease. The earlier the stage, the better and closer to what it was originally. Therefore, it's better to find the symptom at the earlier stage and treat it as early as possible. So, at what stage is the surgery available? Surgery becomes an option when the patient is in the inactive stage, past the active stage. At this stage, medications do not work and the symptom must be treated by surgery. This is like a burnt-out house after a fire, with no foundation left, and we have to rebuild it. Now, what kind of surgeries are available? We have three kinds of surgeries for thyroid eye disease: orbital decompression, correction of strabismus, and eyelid surgery. These surgeries are performed on different parts of the eye, but the order cannot be changed. The surgery on the back part of the eye causes the front part to change. It is like we must rebuild a house only after establishing the foundation, otherwise, the house will be poorly constructed. Now we delve into the orbital decompression here. When we refer to an orbit, which means eye socket, a socket for the eyeball. More specifically, it is a socket in the skull for the eyeball. The protrusion of the eyeball is caused by an increase in the amount of the fat and muscle behind the eye, followed by increased pressure in the orbit. Orbital decompression reduces the pressure in the orbit. Orbital decompression reduces the amount of tissue or increases the size of the orbit, thereby reducing the pressure within it and improving eye protrusion. Now, what kind of orbital decompression surgeries are available? There are three kinds of orbital decompression surgeries. The oldest one is excising the bone of the medial wall of the orbit, followed by excising the outer bone of the orbit, and the latest one is excising the fat in the orbit. Now let's take a look at each one. The first, oldest one is excising the infraorbital bone. This surgery was founded in 1957. As with a dentist sectioning the gum in the mouth, through the maxillary sinus, part of the infraorbital bone is excised. Due to its invasive nature, this procedure was gradually abandoned. The reason why they were discontinued is because of the high probability of causing the patient to see double. There are various reports, and these reports collectively indicate that diplopia appears in about 60% of cases. It's said that removing the pressure with this procedure often causes diplopia because the eyeball and muscle are redirected downward, although this procedure can decrease the pressure by about 4 mm. On the other hand, it is the most suitable for removing the pressure on the nerve of sight, so it is still used in cases of thyroid optic neuropathy. At Oculofacial Clinic Tokyo, we perform this surgery not through the mouth but through the white part of the eyeball. Thus, the physical burden on the patient is relatively low. Now let's look at the surgery excising the outer orbital bone. Based on various reports, we can say that diplopia is caused in 3.8% of the cases, which is significantly lower compared to the previous procedure. This means that this is the surgery least likely to cause diplopia among bone surgeries. However, bone grinding takes a long time and causes significant physical strain on the patient. Also, the bone to be ground down is located between the eye and the brain and thus it can cause damage to the brain. If the brain is damaged, it can be critical, although the risk is not too high. Lastly, let's look at the excision of the fat in the orbit. This type of pressure reduction can cause diplopia in 3.2% of cases, which is the lowest number. Compared to the bone excision, it takes less time to perform and causes less damage, resulting in a faster recovery. However, through the fat in the orbit run important nerves and blood vessels. Therefore, there is concern that this procedure is more likely to cause visual dysfunction than bone resection, and few people in the world perform this procedure. In this surgery, the conjunctiva is cut open. This means the skin is not cut, and thus no scar will be caused there. The video image of the surgery is available on my YouTube channel in Japanese. However, as it is a real recording of the operation, you may find it shocking or traumatizing. Please be careful when searching for and watching such content. Now, we've seen 3 kinds of surgeries to reduce the pressure. So, which is the one to choose? Based on the likelihood of diplopia and downtime, we primarily perform the removal of the fat in the orbit. When the first surgery does not suffice, we perform another surgery. In this case, we excise the outer bone of the orbit. We usually don't do the infraorbital bone excision because it is very likely to cause diplopia. However, as we already mentioned, this surgery is prioritized in cases of thyroid optic neuropathy. Now let me share some case studies. This is the about 20-year-old female we presented earlier. She has the greater protrusion of the right eyeball, which gives an unbalanced impression. Not only the wide-opened eye, but the eyelid is also puffy, and it causes a bag under the eye. As 2 years have already passed since the onset of the disease has entered the inactive phase, it will not heal spontaneously. We performed the excision of the fat in the orbit. We removed 7.1 cubic centimeters from the right socket and 6.6 cubic centimeters from the left socket. Based on the average amount of fat we removed per patient, about 4 cubic centimeters, she had much more fat than most people. Now compare the photos before and after the surgery. The upper photo is before the surgery, the lower is after. After the surgery, her eyes are properly closed, exposing much less white part of the eye. The eyelid and the bag under the eye are also improved. The angle view shows that the protrusion of the left eye is improved and the eyelid is not swollen. Let me show another case. With the protrusion of the eyeballs and the regression of the eye holes, the eye looks like it is popping out. We performed 2 surgeries, and we excised the fat from the orbits and treated the regression of the eye holes. After the surgeries, the exposure of the white part of the eyes is improved and the visage looks genial. This patient used to have ordinary eyelids, but the eyelids are now puffy after Graves' disease occurred. We excised the fat from the lower eyelids and posterior orbit, and they were improved along with the conditions of the upper lids, although the upper lids still looked puffy. We additionally excised the fat from the upper lids and posterior orbit of upper half, which made them look better. You don't have to be what you don't want to be because of the disease. Surgery can do a great deal of improvement. However, any surgery has some risks, and the following complications may occur: eye movement disorders, dysregulation, paresthesia, visual acuity and visual field disorders, and the risk of infection and hemorrhage. It has also been reported that recurrence after decompression surgery occurs in 1.3% of cases, and caution should be exercised during the 2nd year of ocular disease. Now it's the end. Thank you so much for watching.